Hey guys, and welcome. David, bro, if you don't put that water down, are you finished?
I'm done.
Okay.
Dog Talk with Dr. Helene.
Hey guys, and welcome back to another Hey Dr. Helene. So obviously by the title of this video, we are going to be talking about all things family medicine. I have a special guest with me. So introduce yourself and tell the people a little bit about you.
Hey guys, my name is David Daniels. I'm a fourth year medical student at Morehouse School of Medicine, classmate of Dr. Helene. So happy to be with you guys today. I'll be going into family medicine. Recently matched at Morehouse School of Medicine.
Woo!
So excited to talk a little bit about this specialty right now.
So why did you decide to go into medicine?
Why did I decide to go into medicine? Well, number one, it's a very honorable career. You get to make a living out of helping people, and so that definitely drew me in. I knew I didn't want to be stuck behind a desk, so that was also a calling card. Of course, now with EMRs, you spend so much time charting anyhow, but you do get to round your patients, interact with people throughout the day, and just help them. I've also lost some family members to various illnesses, so just knowing that I could make an impact in the lives of my patient and just help people to live longer, healthier lives is also a huge motivation.
Thanks for sharing that. So why did you choose family medicine, and what experiences led you to choosing this field?
So coming into medical school, I actually didn't know much about family medicine at all. I had only shadowed a pediatric emergency medicine physician. And so coming in, I thought emergency medicine or pediatrics, just because that's all I'd been exposed to. But during my first year of medical school, I got involved with the HEAL clinic, which is our student-run free clinic at Morehouse School of Medicine. And a lot of the physicians who helped us out at the clinic were family medicine physicians. So just getting to see what they can do, the fact that they feel totally comfortable seeing anyone who walks in, whether it be a kid, someone middle-aged, or a geriatric patient. They felt comfortable, they had the knowledge base to treat anything that walked in. So that was really my first experience with family medicine, and it really grew from there. So continue being involved with the HEAL clinic. Third year, family medicine was actually my very first rotation. Fell in love with it all over again. And yeah, so these little things just kind of added up to me being where I am today.
Nice. Did you have a mentor at all along the way?
So along the way, I've actually picked up mentors. So one of my mentors is Dr. Molly. She was really involved with the HEAL clinic, and she's a family medicine physician. So really just looking up to her, wanted to be like her was like a super strong motivation. And so she's just been in my corner since the beginning of medical school, and has written letters of recommendation for me, and just helped me to get more involved in the field of family medicine. So.
All right, yeah. Shout out to Dr. Molly for doing all that for you.
Helene was also part of the HEAL clinic leadership team, so she's very familiar with Dr. Molly.
Yeah, she's fantastic. So yeah, it's super important to have mentors just kind of throughout your journey, so they can help guide you, and it seems like Dr. Molly did that for you.
Definitely.
So when you applied to family medicine during your last year of med school, did you have any weaknesses in your application? And if so, how did you overcome them?
I feel the biggest weakness in my application was definitely my step 1 score. It definitely wasn't what I wanted it to be. And so the easiest way for me to go about correcting that was just to do much better on step 2. Which I did, so I feel that was how I took care of that weakness. Outside of that, I think I was a pretty well-rounded candidate for family medicine.
Did you have any really big things that stood out in your application that were strengths, and you feel like that helped you to really match to your #1 choice in family medicine?
I think the biggest thing is just showing your interest in the field and having that come across, showing that you're passionate about the field. So for me, one of those things was the HEAL clinic. So just being a leader in that being a volunteer from year 1 and then getting on the leadership team for the last 3 years definitely stood out. A lot of program directors brought that up, and just the various things that I learned being on that leadership team. Another thing that stood out a lot was some research I did. I did some research into chronic diseases in the Caribbean community living in Metro Atlanta. So just being able to speak about that. I'm Caribbean, I was born and raised in Guyana, so I just love talking about it. And so when people do bring up the research, they can see my passion, they can see that I was interested in chronic diseases, and with family medicine we do deal with a lot of chronic diseases, so it just showed that I was interested in the field.
Any advice that you would give to third-year med students who are wanting to match into family medicine?
So I think the biggest piece of advice would be to try to do a sub-I in an area that you're trying to go, just so that you can get more interviews in that area. I knew I wanted to stay in Atlanta, so I actually didn't do any AWAYS, but I think doing AWAYS in areas or potentially at institutions that you'd like to match definitely gives you a leg up. You can go there, show your knowledge, show that you're good with working people, and just make connections with people who are in those various programs, so that can help you get a leg in the door, a higher chance of getting an interview and then matching with the program. A sub-I, so that stands for a sub-internship, and so basically our first year of residency is called the intern year, and so this is called a sub-I because essentially you're a fourth-year medical student, but you go to various institutions and you essentially operate as an intern, just essentially try to simulate what you'd be doing during your first year of residency.
Any future aspirations or goals that you want to achieve as a family medicine physician in the future?
Yeah, so with family medicine, you can do so much. It's so broad, and I really like that about it. So one of my main goals in the future is to have my own clinic, and so with family medicine, I know I'll be trained properly and fully capable to see any patient that walks in through my clinic doors, from, like I said before, a pediatric patient all the way to a geriatric patient. And so just being able to run full scope primary care medicine, I can see people who are pregnant, I can see teenagers, I can see people dealing with chronic diseases. So definitely family medicine will allow me to do that. And then one of my other goals is to just get more involved in global health initiatives. Being born and raised in Guyana, I want to be able to go back and do some global health / public health work back home. And so with family medicine, again, it's so broad that we actually do get some training in prevention. So not only curative medicine, treating the medical illness that the patient has at the time, but also knowing various ways that we can prevent various patients from developing further complications from their medical illnesses. So yeah.
Nice. And do you have any plans on doing a fellowship?
At this point, not too sure. The only fellowship that I think I might be interested in is just a few programs that have like a global health fellowship. They're like 1 or 2 years, so maybe doing that just so I'm better trained and more capable to go back and do public health work / global health work home and in other countries abroad. But at this point in time, general family medicine, I think, will give me the base level training that I need to achieve my goals.
Cool. Okay, and then a question that I like to ask anyone, and it's not really related to medicine, is so who are you outside of your white coat? What do you like to do for fun? What do you do in your spare time? Do you have any hobbies? You know, who are you outside of Dr. Daniels?
Usually I really enjoy going to the gym, working out, doing outdoor activities. I like biking, going on nature walks and trails, hiking. I also enjoy playing video games, and watching sports. Of course, all sports are canceled right now, so I've been playing a lot more 2K lately.
Fair.
Yeah, my 2K player is looking really good now. So, but yeah, I really enjoy hanging out with friends. I have 2 younger brothers, so spending quality time with them and close family members is also really enjoyable. And I love food, so I really enjoy eating.
That I can attest. That is a fact. That is a big fact. All this man does is eat. All right, last question. Any just general advice that you would give to a pre-med student looking to get into med school, or a current med student who's struggling? Just any lasting advice that you have to give?
One of my favorite mantras or quotes is train hard so that you can fight easy. And basically, I think that's appropriate just because going into medicine, it's a long and arduous journey. You're likely to face challenges along the way, but just knowing that whatever challenge you face, they can make you stronger. You can use it as stepping stones to achieve your goals. So just keep on fighting, get through those challenges, and know that it'll make you stronger and make you be the best you that you can be for the future and for your future patients. So
I love that. I love that advice. All right, well, thanks guys. That is the end of this video. Feel free to like, share, and subscribe below. Comment whatever other specialties that you want to see. If you are interested in family medicine or anything that David was talking about, I will put his information in the description box below so that you can contact him. That's it.
see ya.
Peace. Thanks for watching.